Meeting the demands of fiscally conservative lawmakers could prove key to passing a Senate health care bill, but pulling that off could mean huge changes to the proposal that's on the table right now. So is that possible without losing support from other lawmakers? Here for a fair and balanced debate on the push for reform, Doug Heye is a former communications director for Senator Richard Burr and then Lieutenant Governor Michael Steele. Good to see you. And Richard Socarides is a Democratic consultant and former Clinton advisor. Nice to see you, Richard. And let me start with you, because it seems as though, at least right now, the votes for the Democrats just aren't there. They were able to get to 60 to sort of move this forward one step in the process, but now we hear that President Obama is headed to the Hill tomorrow. Will he be able to seal the deal?
Well, I think he's headed to the Hill tomorrow because he realizes that this is one of the most important things he has to accomplish as president in his first term. I think, it's a tough road ahead, but I think he will get to 60. He will find a way. He's going to the Hill. It's very unusual, but he's doing it because he realizes it's really important at this moment, and this is a key moment.
Doug, do you think the president going to Washington tomorrow is a sign of desperation, or is it a sign that he thinks he's really close to getting that magic number 60, that filibuster-proof number, in order to get this through in the Senate?
It really could be both. Obviously, this is an important priority for the president, something he's pushing hard for, but he would not be going to Capitol Hill on a victory lap. He's going to urge senators, and as you mentioned earlier, it's really those moderate senators. You look at Blanche Lincoln, who's really considered the most vulnerable Democrat who's up for re-election in 2010. Earlier today, the Johans amendment that Molly referenced, she voted, she flip-flopped on it. She literally changed her vote during the voting period on the Medicare cuts. She's going to have to explain to her constituents why that's an issue, and certainly Barack Obama is going to be pushing her. Another Democrat that you really have to look at is Joe Lieberman. Democrats are paying the price for their abandoning him in his re-election a few years ago.
Well, Richard, let me ask you, I mean, we could talk about Joe Lieberman. We should, I guess, call him an independent rather than a Democrat. He's a former Democrat. And Blanche Lincoln, Richard, who Doug just mentioned, is up for re-election, a tough re-election for her. This is really tough. How do you get to 60 with a Senator Lieberman, Senator Lincoln, Senator Nelson of Nebraska? How do you get to 60 with those three alone?
It is really tough. And as Doug said, and I agree with him, this is definitely not an Obama victory lap. This is an effort at a very key moment to get people to do the right thing. And I think we have to remember why we're doing this. We're doing this because our health care system is so broken. And President Obama realizes now that in order for us to have an economic recovery, we have to fix our healthcare system, because small business especially small businesses will collapse left and right. The healthcare costs are skyrocketing at such a level. I saw somewhere, multiples of 100%, multiples of 20% a year. They're skyrocketing so that unless we fix this, we are not going to be able to have an economic recovery. So it's not really now a question of whether or not we do this. It's how we all come together, how the Senate puts together 60 votes. I mean, I myself went to see my private physician here in New York. I have insurance for a flu shot the other day, and I got charged $165 for a flu shot. That's what they tried to charge my insurance company. It's that kind of skyrocketing health care costs that we really have to tackle right now, and that's why this is a key moment.
Hey, Doug, what do you think about compromises here? Because, of course, the Senate this is where the deals are struck. This is where people get together behind closed doors. It seems like the haggling right now, the compromising is between Democrats, not necessarily between Democrats and Republicans. But when you look at the discussions over the government-run health insurance, the so-called public option. You talk about funding for abortion, which was a key debate point when this went through the House a few weeks back. What do you think is going to happen at the end of the day? If we have legislation that comes out of the Senate, what's it going to look like?
Well, it's really too early to tell. I think you're right. The Democrats are really debating amongst themselves. They're trying to compromise amongst themselves. They own the game. If this fails, it's a failure of the Democrats. If it passes, If it's a good thing, the Democrats will be able to take credit for it. But I think the small business tax, as we mentioned small business earlier, that'll be crushed by this bill, really become a problem. And, you know, you look really what the first predictions were for this bill was Democrats said they would have this passed by the August recess. And, Rick, I don't know if you can see behind me, but there's snow right now in Washington, D.C. They've not gotten this done yet. Democrats hope that Barack...
We'll have it by the Christmas recess, Doug.
You sound pretty confident,
Obama will be more
Richard.
successful in his persuasion than he was in Copenhagen with the Olympics.
Richard, you sound pretty confident. I'm just wondering what you think. Is there going to be a public option at the end of the day, a government-run health plan on the Democratic side, or is that going to be one of those things that is allowed to sort of fall by the wayside for the sake of getting to that number 60?
I think we will have health care reform that includes, as a small part of it, a public option. Remember, we're not talking about a broad government-run single-payer program. We're talking about a public option, an option which is a small part of this plan. And I think we will end up with most Democrats and some Republicans, most Democrats, not every Democrat, and some Republicans supporting a plan that the president is able to put together as a compromise because the country right now needs it.
Doug, and let me give you the last word here, because a lot of Democrats, I've heard them, they've said to me personally that the Republicans putting up their roadblocks has absolutely nothing to do with health care reform and simply everything to do with not wanting to allow the president a victory on his signature domestic policy agenda here. Are they wrong when they talk about that so cynically?
Yeah, the reality is if all the Democrats vote for the legislation, it passes. It's that simple. And I'll tell you, a lot of Republicans have offered alternative legislation. You know, you had Senator Richard Burr on earlier, my old boss. He's introduced comprehensive health care reform with Tom Coburn. Companion legislation has been introduced in the House. Republicans have contributed to the conversation. But if the Democrats can't really rally around their own party and push this bill through on their own, they're headed for failure. And they're headed for electoral failure, too.
Well, we'll be watching, and they're going to certainly be working a lot every weekend from here on out. Doug Heye, Richard Socarides. Gentlemen, thanks so much.
Thank you.
Now to